All right, so this is going to be a second part for our lecture series about the Respiratory Disability Benefit Questionnaire and Pulmonary Function Test. This is an example of the Respiratory Disability Benefit Questionnaire that's publicly available on the VA website. You just Google search publicly available respiratory DBQ. This comes right up in the search. And this is just going to walk through the different fields that we fill out to successfully complete this. So first one, name of veteran, social security number, day of exam, all that'll be pre-populated by the vendor. And this will also be completed, also pre-populated by the vendor. You mark if the exam was conducted in person or not. And we always review records. So any pertinent service treatment records, you're welcome to put here. Otherwise, if there's a lot, or some people just with their style, they put refer to see file or see file reviewed. Really just, it's a personal preference. If you want to highlight any specific records, so you're more than welcome to in this section. This is where the claim condition is listed, and this is a condition that is provided to us on the VBMS order request details from the Veterans Benefit Administration. So we just cut and paste what we have as the claim in this section. I do the diagnosis section last. After I've gone through the records, talked to the veteran, done the pulmonary function test, done my exam, this is the last section I do, is where I select a diagnosis. The options are that the veteran does not have a current respiratory diagnosis. There's also asthma, emphysema, COPD, chronic bronchitis, constrictive bronchiolitis, interstitial lung disease, restrictive lung disease, mycotic lung disease, such as histoplasmosis, blastomycosis, coccidiomycosis would also apply here, sarcoidosis, benign or malignant, neoplasm or metastases, pulmonary vascular disease, that includes a pulmonary embolism, pleurisy with empyema, or any other diagnosis. So the medical history section, we focus on when the symptoms started, the onset, how they started, what was the situation, was it a gradual onset, did it happen after deployment, did it happen after an illness, did it happen after COVID infection? Then we go into the course, did it get worse, better, the same? And then I always put current symptoms. What are the current symptoms? How are they affecting the day-to-day activities of the veteran? What kind of treatments have been tried? Things like that. Any specialists that may have been seen. This section then goes into medication use. So, is there oral steroids or parenteral, like IV steroid medication that's required, okay? This section 2C is where inhaled medication, this is where you check if they're on like albuterol or if they're on inhaled corticosteroid or antimuscarinic like Spiriva. Okay, this is going to be those medications or any other medication as well. Any oral bronchodilator use would be marked in this section, and any antibiotic use would be here. And then indicating if there's oxygen. These are the different conditions then that will be selected depending on what the veteran's claim is for and what their records show. But they have asthma, bronchiectasis, sarcoidosis, pulmonary embolism, bacterial lung infection, mycotic lung infection, again, the histoplasmosis, coccidiomycosis, pneumothorax, gunshot or fragment wound, cardiopulmonary complications, respiratory failure, tumors or neoplasms, or other. A lot of times I find myself checking other, to be quite honest, especially if they haven't been diagnosed with some of these other conditions. If they have asthma, they want us to indicate how many, or have there been any asthma attacks with respiratory failure in the past 12 months? And okay, if they haven't had respiratory failure, have they just had any visits that have required care for flare-ups of asthma? And that could be urgent care visits, same-day visits, or quick care visits with the primary care. That's where I put that in here. And then you indicate the frequency. Are they going in for urgent care visits monthly or less frequently than that? Okay. Bronchiectasis, I only really make this diagnosis if it's in their medical records. I really cannot make a diagnosis of bronchiectasis just by, chest x-ray alone. Most of the times it does not show up always on chest x-ray, sometimes, but not always. And I can't make it alone, this diagnosis with pulmonary function tests. So that would have to be in the records most of the time. But those are the questions for bronchiectasis. Sarcoidosis, again, that would be in the medical records. We're not allowed to do any lab work or kind of full workup like that. Pulmonary embolism, again, would be in the medical records. We're not making that as a new diagnosis at a compensation and pension exam. Bacterial lung infection, those would be some examples that they have, but you can also put other. Mycotic lung disease for those. This is that section to complete. Pneumothorax, gunshot fragment wound, and then any cardiopulmonary complications like cor pulmonale, right ventricular hypertrophy, pulmonary hypertension. That's where this goes. If there's been respiratory failure, acute respiratory failure, then that would be documented in Part J. Tumors and neoplasms would be in Part K. Again, that would definitely be in the medical records. And it goes into, has there been surgery, chemotherapy, radiation? Okay, so that'd be all in the records. And then this is where you put other physical findings. So this is where I write if they state that they were exposed to asbestos, or I listen to their lungs and I hear wheezing, or I check their pulse ox and maybe it's 89% on room air. With walking down the hall, but at rest, it improves to 93% on room air. This is where I write any of those findings from my exam, the day that they see me. If there's any scars, you indicate it here. Any diagnostic testing, so, MRI, CAT scan, high resolution CT chest, bronchoscopy, or biopsy, that would be all the medical records. We do have the option to order a chest x-ray the day of their compensation and pension exam. And then here we enter our pulmonary function test that is performed in office. Sometimes it's a send out too, but these are where the pulmonary function tests are documented. It states on the DBQ, most respiratory conditions require pulmonary function tests. However, pulmonary function testing is not required in all instances. If pulmonary function tests have not been completed, you need to indicate the reason why. So outpatient oxygen would make it not possible due to pulmonary function tests. I mean, if they need oxygen, doing forceful exhalation could cause them to become hypoxic, risk of fainting. So you would not want to do that. Respiratory failure, again, not wanting to do pulmonary function tests, or pulmonary hypertension, heart issues, low exercise capacity test results, or another reason. Again, please refer to video 1 where I go over the contraindications for pulmonary function tests. You can screenshot that, print it, have it as a reference. But these are the results if the pulmonary function test is safe to do. And again, you'll see the FVC as the percent predicted. We went over that on our first lecture. FEV1, the percent predicted. And then the FEV1 to FVC, that's the actual ratio. Okay. And they have areas to fill out for pre-bronchodilator pulmonary function test, and then post-bronchodilator, like albuterol. Okay. Just please, again, make sure that you're doing percent predicted for FVC, FEV1, and then that ratio is the percentage, not the percent predicted. DLCO is optional. We'll get into that on our following lectures. And then we choose which test most accurately reflects the veteran's disability condition, their pulmonary condition. So FEV1 is really for asthma. That's a real indicator for asthma, and we'll go into that in our next lecture. FVC, that's really helpful for restrictive lung disease, especially if the FVC, functional vital capacity, is low. DLCO can also be really helpful for restrictive lung disease. FEV1 to FVC, I don't normally check that too often, but typically FEV1 for asthma, FVC for restrictive lung disease, and DLCO as well for restrictive lung disease. If post-bronchodilator testing is not performed, then you indicate why. And most commonly, post-bronchodilator testing is not completed if the pre-bronchodilator results are normal. Okay. As I'm going to reference our first lecture here, where went over that if the FVC percent predicted is more than 80%, the FEV1 percent predicted is more than 80%, and the FEV1 to FVC ratio is more than 80% predicted, all those percent predicted, you don't typically do post-bronchodilator testing, okay? So you can indicate, you can also free text another reason. Fatigue might be a reason. They felt lightheaded or dizzy or fatigued after the initial spirometry tests that were done without a bronchodilator. So you would describe that there. They just couldn't continue and do post-bronchodilator testing. And then if you are doing for the DLCO, you need to indicate if it's indicated for the veteran's condition or not indicated. So, DLCO is mostly indicated for restrictive, if you're looking at restrictive lung conditions, and we're going to go into that in our next lecture. And then if the veteran has multiple respiratory conditions, then you list them and indicate which of those conditions is primarily responsible for the pulmonary function testing results. This asks if exercise capacity test has been performed. That's not something that we do as CMP examiners, but you indicate yes or no, and then if yes, the results. And then any other significant diagnostic test or findings you can put here. I do use this section for if the veteran has had initial years ago testing that established a diagnosis of asthma, and it showed a low FEV1 years ago before they started on their bronchodilator treatment, and they're seeing me today and their pulmonary function test is normal because they have controlled asthma. So I'll try to dig up their initial pulmonary function results, FEV1, FVC, and FEV1 to FVC ratio from before they were diagnosed with asthma, so I can put it in this section. And I put a comment in the remarks that the veteran's pulmonary function test today is quote unquote normal because they are on chronic asthma maintenance therapy, but section 4I shows their initial results that establish their diagnosis of asthma. So I'll do that quite commonly. Functional impact. This is how does the veteran's respiratory condition impact what they can do on a daily basis or the occupation. And so with this, climbing stairs, running, working outside, being outside if there's fire smoke or bad air pollution. So this is where you want to put that. Stop having to stop and catch breath, things like that. And then you could add any remarks you want at the end. And then this is your information. So hopefully that helps going over this respiratory disability benefits questionnaire, give you an idea of the different areas and make it maybe a little bit less intimidating. So I'll see you back in the next video.